All right, so let's continue on here. This is going to be 5G, your tachycardia for unstable patients. The protocol we just went over, remember, is your stable patients because we were giving medications. This is going to be just a follow on that, but for unstable patients. So again, you got your treatment priorities box over here. We'll read through these real quick. There's only 7 of them. And it starts with vital signs, IV access, analyze your rhythm, rhythm-specific treatment, synchronized mode, utilized each synchronized cardioversion, consult online medical control for pediatric patients. If protocol does not convert, or if protocol measures do not convert the rhythm, control symptoms and restore your blood pressure, or restore the patient's blood pressure, and then contact online medical control. We've read the unstable box, the symptoms that can make them unstable. Again, EMD all the way through advanced, nothing changes. It changes when you get down here to paramedic. So we'll start here, paramedic. For adults, analyze and treat per flow chart below. Pediatrics, always, we're going to consult online medical control for treatment plan. So we go down. For adults, is the heart rate greater than 150 per minute? For pediatrics, afebrile heart rate greater than 180 per minute. If not, again, we're just going to treat whatever protocol we're going by then. If it is, and they are unstable, then we will go down. If they are stable, then we're going to go over and we're going to treat the protocol like we just talked about in section 5F. So unstable with symptoms and adult systolic blood pressure less than 100, or your systolic or your pediatric systolic blood pressure less than 70 plus 2 times age in years. If that is the case, we're going to go down to synchronized cardioversion. They're an unstable tachycardic patient. So what we're going to do is we're going to do synchronized cardioversion. So we're going to double check prior to each and every synchronized cardioversion and assure the sync mode is utilized prior to energy delivery. So there's not a diagram on this. It will be later on. We've kind of seen a couple diagrams of the monitor, but there's a sync button, and that's what we're going to hit, and we're going to make sure that that is utilized. For adults, if the systolic blood pressure is greater than 80, we're going to pre-treat that patient with midazolam, aka Versed, 0.1 mg per kg, maximum of 5. So again, we talked about this kind of with pacing. We just want to pre-treat with midazolam to not necessarily sedate them completely, but to keep them from experiencing that full amount of pain. So what we're going to do here is we're going to begin at 100 joules synchronized if rhythm persists and the patient remains unstable. Then we'll repeat then at 200, 300 to 360. So your narrow complex tachycardias, just remember you're going to start at 100 joules. You're not defibrillating the patient. You're trying to synchronize cardiovert this patient. So it's going to start at 100, move to 200 to 300 to 360. If the tachycardia resolves after that synchronized cardioversion, then we will go down and we will give amiodarone for ventricle tachycardia only. Everything else, then we're just going to treat per protocol. So if it's VTAC, we'll give that amiodarone 150 over 10. If it's SVT, then we're just going to monitor the patient and get them to the hospital if we've converted the rhythm. If we do not convert that tachycardic rhythm, then we're going to consult online medical control. So this is talking about after you've gone through your 100, 200, 300, 360, it's still not converting. At this point, hopefully we're already transporting, and we're going to consult online medical control and see what they would like us to do at that point. So again, just quick little run through. Unstable, blood pressure less than 100, and they've got monomorphic VTAC or PSVT or whatever it is. We're going to cardiovert them starting at 100 all the way up to 360. If it's VTAC, we'll give amiodarone if the tachycardia resolves. If not, if the tachycardia does not resolve, we'll consult online medical control. So pretty short, pretty simple on that. Any questions? Feel free to ask.